Imagine a situation where profound suffering seems overwhelming, and a loved one faces an unbearable medical condition. These moments can lead to incredibly difficult questions about comfort, dignity, and the very definition of life itself. When facing such profound challenges, understanding different perspectives can bring clarity and peace. No, active euthanasia is not permitted by Jewish health law. The Jewish tradition views human life as infinitely precious and a gift from God, regardless of its duration or perceived quality. Therefore, any action taken with the direct intention of ending a life, even to relieving suffering, is strictly forbidden. The core reasoning behind this prohibition stems from the fundamental Jewish belief that only God is the ultimate arbiter of life and death. Human beings are considered stewards of their lives and bodies, not their owners. This means that while we are obligated to heal and preserve life, we are not granted the authority to intentionally hasten its end. This principle applies even when an individual is facing severe illness or pain, as every moment of life holds inherent sanctity. This halakhic stance differentiates between active euthanasia and allowing a natural death. Jewish law does permit the removal of obstacles that are artificially prolonging a patient's suffering or preventing a natural death, such as removing a ventilator when the patient has no chance of recovery. However, this is distinct from actively intervening to cause death. It is crucial to seek guidance from a knowledgeable rabbi and medical professionals in such complex situations to ensure all actions align with Jewish legal and ethical principles. A key concept here is the distinction between hastening death and allowing nature to take its course. Jewish law forbids active intervention to hasten death, known as grama, but permits passive withholding of treatments that are futile or merely prolonging the dying process, which is sometimes referred to as nivel hamet, or disgracing the deceased through unnecessary suffering. This nuance highlights the deep respect for both life and the natural process of dying. Navigating end-of-life decisions within Jewish health law emphasizes compassion, the sanctity of life, and the importance of professional and religious guidance. It ensures that individuals receive comfort and care, while upholding the profound value placed on every breath and moment. This approach helps families find peace knowing they are honoring both their loved one and their faith during life's most challenging transitions.
If you value faith and wellness, like, subscribe, and stay connected.